It's cuddle time at Cortland's Child Care Centre in Johannesburg. These children are waiting for adoption in this children's home, which used to have an HIV and AIDS hospice. But recently, they've made some sweeping changes here. The hospice has been closed down because of the successes in HIV treatment and a huge reduction in mother-to-child infections. So, Jackie, this is where the HIV-positive kids were in the hospice used to be, and now you have kids who are ready for adoption.
That's right. So, these cots, there used to be children used to come in that were really sick and requiring end-stage care. They would spend a few weeks here or a few months, depending on how ill they were, and then they would pass on, and then a new child would come in and take that bed. The worst year that we had was in 2003, where we had 84 children that passed away in that year. And then from the last 3 years, we've had none.
And it's largely because of this man's efforts, the Health Minister, Dr. Aaron Motsoaledi. He has been credited at policy level for the success of South Africa's HIV treatment strategy.
It was not rocket science. It was just really doing the correct thing. The science of HIV/AIDS has been researched all over the world. We have got world-class scientists ourselves. All I said is let's listen to them. What do they have for us? We brought them together, and there we are.
So, Minister, despite all the successes that you're having now, there is still a huge problem because South Africa still has the highest number of people living with HIV and AIDS in the world, isn't there?
We are. But if you check, we're also responding accordingly, because the programs we've put are massive. The number of people who are on treatment are more than in any country. As you know, we are now at 1.9 million people who are on treatment. We launched the biggest AIDS city campaign to test 15 million South Africans so that they know their status. We expanded the health facilities that were providing ARVs from 490 facilities to 3,000 facilities. We increased the number of nurses who were certified to start what we call nurse-initiated HIV asylum, because we have got few doctors in South Africa, especially in rural areas. There were only 250 nurses who were so certified. Today there are 10,000.
South Africa still has a long way to go, but with life expectancy levels on the increase, the future looks a little brighter. Milton Nkosi, BBC News, Johannesburg.